request for FY26 is $441.2 billion, correct? Okay,
Yes.
and how much of your medical services request is for personnel? And how many personnel through this medical services request do you intend to employ in FY26?
At the current, and I also have, I have my budget, Andrew, here as well, if there's the numbers that we need, if Mr. Chairman, with yours. The issue that you brought up is right now there are currently 465,000 employees in VA as a whole. VHA has 409,000 of those.
I'm so sorry, Mr. The question is, how many staff do you intend to employ through the medical services budget in FY26?
Do we, Andrew?
396,000.
396,000.
396,000.
Yes.
Okay. The FY25 request, and just to be clear, that's intended staffing of medical services in FY26. Say the number again.
395?
396,000.
396,000.
396,000. Okay.
Yes.
How many physicians do you intend to employ in FY26?
Physicians.
Oh, physicians, we employ a large number of physicians.
I'm sorry, who are you?
Andrew is our budget. Right now, we currently have 28,868 physicians.
Yeah, so how many physicians do you intend to employ in FY26?
We're not cutting physicians, so at this point in time, under that budget, we're still looking
So
to continue at 28,868 at minimum, because we're also having to add physicians which are not, which are exempt. So we're
here's
adding those.
what we
as can.
usually,
And because,
this is, for example, the budget request from 25, and it specifies that for 25, we're requested 25,099 physicians. So we usually get this in advance of this hearing. So my question is just how many doctors you intend to employ?
yeah, and at this point in time, I'll take that and get it back to you. As I told you yesterday on the phone, there'll be some more information coming later this week.
Okay, how about dentists?
Same answer.
Do you have the number for nurses?
We currently employ 91,040. I'll have the.
But my question is how many?
And I understand, and the breakdown will be provided as I said yesterday.
Okay, well, how have you calculated the money you need for personnel without having yet decided how many personnel to employ?
In the breakdown of the budget, which right now is still going on, these are the numbers that we are using to go forward from last year's budget into this year's budget. And at this point, there is also a gap in how many we have currently hired and not hired. And so at this point, I'll have the numbers for you that we've not provided yet. We'll be providing those numbers.
But you've proposed about $17 or $18 billion cut to the medical services account, correct?
That is not, the president's budget makes adjustments to the funding that devote additional funding appropriate fund to community care. This is not a cut to total VA, to funding to VHA. In fact, the total medical care budget grew by 17% to $24 billion.
Not medical care, medical services. So here's your,
Okay.
just to be clear, I mean, the chairman mentioned this, we usually get,
I understand completely.
specifies how many folks you intend to employ. We have a 26-page PowerPoint, but in that 26-page PowerPoint, here are specified about $17 billion in cuts to the medical services budget. So what are you cutting in medical services? Specifically, who are you cutting, since that's exclusively personnel?
Again, and this is the issue that we have right now, and I'll just state this for either of us to go back in circles. We'll be providing more of those numbers, as I said yesterday on our phone call this week. So at this point in time, the numbers that we're providing are the numbers that we have at this point. I'll be happy to talk to you further about those later.
And understand that's why we usually get these in advance of this hearing. I mean, I'm wondering if we need to reconvene having received the full budget request. Because the thing that is causing a lot of consternation is this proposed $17, $18 billion cut to medical services. I mean, and so today is the budget hearing where you justify the budget request. So how do you justify this cut to medical services, and who are you going to fire in order to pay for it?
And I'll go back to the same answer I gave you just a few minutes ago, I mean, in this process, we'll have the more information on that part of it as we go forward. The basis of the budget was based on our workforce as it existed and moving forward, and the numbers have not been cut to the medical.
I'm sorry,
or
yes,
the
it
care
has.
budget.
You have in your PowerPoint here, 17 to 18 billion dollars in cuts to medical services. Again, this is a 26-page PowerPoint to justify the budget. So, and this is the budget hearing. So who's getting fired? I don't know, Mr. Chairman, if we need to reconvene
We
after
don't-
they send us the materials, but I think this is insufficient. We clearly, and I'll follow up in my next round. Thank you, Mr. Chairman.
Senator Fisher.
Very significant sterilization failures that led to the potential exposure of thousands of Georgia veterans to bloodborne diseases. And indeed, some of those who may have been exposed later tested positive for HIV and hepatitis. In March of this year, the Inspector General conducted an additional inspection of facilities at Dublin and found continued egregious failures. Can you assure the subcommittee and Georgia veterans that these issues at Dublin have been resolved?
Yes, I've actually been to Dublin. I was there about 2 months ago, and we've gotten reports since then. This was about the time Dr. Lieberman, who is our chief doctor, who is over VHA, has confirmed this as well, that those have been replaced. The problem there is a conversation we just had a few minutes ago about leadership. And that's what we're trying to correct. Right now, there's still, we're trying to get permanent leadership into the Dublin facility. And for those who may not know the Dublin facility, this is a facility. It's a great part of the state of Georgia. That's my, sort of, I got a lot of friends and family down there, but it's harder to recruit down there. It's harder to get folks to come into that facility and want to be there long term. So we're trying to work that out, because I think this is a leadership problem.
Yeah, and I want, and forgive me, Mr. Secretary, I want to get to the leadership at Dublin, but just to be clear, in order to ensure that we're
yes, they're safe.
informing the public, your testimony is that these
Yes,
issues
they're
have been
safe.
resolved
Yes.
at Dublin. And
Yeah.
does that include all of the outstanding Inspector General recommendations that were found in March? The March 6th report says that there were significant failures to resolve previous OIG identified deficiencies, failure to fully implement SensiTrack, which is an electronic surgical instrument tracking system, failure to address concerns of the SensiTrack coordinator's performance on implementation, failures to resolve concerns related to sterilization facilities. Have all of the Inspector General recommendations with respect to Dublin sterilization, which were not yet implemented in March, now been implemented? No problem.
To my understanding, yes. And I'll be happy to, because
Yeah.
this is, again, for you and I both in Georgia.
course.
I'll be happy to go back and look at that again. My understanding is, yes, Dr. Lieberman said it has, but I'll be happy to go back and look at that and make sure.
Yeah, and that same March inspection, in addition to the not yet completed or implemented recommendations from the past OIG report, again at Dublin, this is March, the OIG determined that sterilization and operating room staff failed to remove non-conforming surgical instruments from the rectal tray. OIG found additional surgical instruments in non-conforming condition, and that contrary to policy, staff reprocessed and used non-conforming instruments at the facility. A range of other failures. That was in March. So your assurance that the Inspector General's recommendations have been implemented is appreciated. And I would welcome any follow-up you can provide as soon as possible, so that we can reassure folks who are served by this Dublin facility that they're safe getting care there.
I will definitely do that. And not to give away, there's some issues at Dublin, especially with this. This is, as you well know, probably before your tenure as well and mine as well, Dublin has had this, there's been some issues down there before. We're going to make sure we're staying on top of it. But I will, again, correct you. And
Well,
I'll
I
get you
think,
some information.
and you
before.
mentioned that at Dublin, leadership is a major issue.
Yes.
And as of, we got this report in May. So as of May 9th, we received a report that the recruitment of a new medical director at Dublin was on hold due to the hiring freeze. Now, I know you have faced substantial pushback on the effects of that hiring freeze. Can you confirm that you've changed course and you've exempted that position now from the hiring freeze?
Those are
Somebody into
exempted, yes.
Dublin?
As I shared yesterday on the phone, those are exempted, yes.
Okay. And when was that exemption made? Because this was we got this on May 9th, said that recruitment of a new Dublin
May 15th.
director, May 15th.
Yeah.
Okay, thank you very much.
So that would have been after.
Atlanta. Recent Inspector General report focused on Atlanta. This is a June 12th report on staffing shortages, among other issues. Now, and I think you know this, Mr. Secretary, for years, the wait times at the VA Medical Center in Atlanta have been driven in large part by staffing shortages. I've heard it from the leadership there year after year. This Inspector General report found, as of June 12th, 208 vacancies at the Atlanta VA, including 67 provider, 42 registered nurse, 32 licensed practical nurse, 49 medical support assistant, and 18 pharmacist positions short at the Atlanta VA. What is your goal, the date that you'd like to bring the Atlanta VA up to full staffing, please?
To hire them all. If you got any,
And by when is my question?
as soon as possible. I mean, there's no delay here in this. This is and I think if we would also look at the Atlanta market as well in healthcare, we'd also see other at Piedmont, also at Northside, also at the St. Joe's and others having similar shortages in their staffing. Atlanta is a market like a lot of other markets in which healthcare, especially CNAs, LPNs, or RNs, are in great demand. They're the ones that are controlling the market. So is doctors as well.
And the wait times, as you know, in Atlanta are a particular issue. Of course, there are wait times at other facilities as well. But and
But
I
no, there's
appreciate
nothing.
your
I think there's
ambition.
nothing stopping.
I
us.
appreciate the ambition of as soon as possible, but I'd like to know, I mean, we'd like to work toward a deadline. So can you give me a date by which you'd like to ensure the Atlanta VA is fully staffed?
Well, Senator, I think you know that that's not something I can give you, but I'd be happy to do a health fair with you, and I'd come down and you and I could recruit these workers.
Well, I tell you what, why don't you?
I'd be happy. I mean, we'd be happy to do. I'm not trying to be funny here.
I know, no,
I
that's
want to do
fine.
this.
I'd love
really
to work
want
with you. I'd love to work with you to make
Yes.
sure we recruit those healthcare workers. What I'd also like you to do is to get with your staff, get with the VISN, get with the leadership at the Atlanta VA, and come back to me and the subcommittee with a date by which you believe you can fill those open positions. Can you do that?
Well, I would definitely get the information to see what their goals and targets are.
Well, we got to have a goal.
Yeah, and I agree with you. So we'll get with that and we'll see what we
So
can.
you'll come back with a date.
We'll see. Well, I'm not sure we'll get a date. I'll have to talk to Atlanta. I mean, we'll see what their actual recruitment is because I mean, again,
That's what I'm saying. I want you to talk to the leadership in
Yep.
Atlanta. I want you to talk to the VISN. I want to talk to your staff, and I want you to present me and the subcommittee with the date by which you think it's feasible to fill those spots.
I'll be
I'm not-
happy to present you a plan, but also you're also setting up a date in which I understand you're trying to do to set up a date that may or may not be capable because you couldn't get the same answer from Northside
Well,
CEO
yep.
or Piedmont CEO or anyone else. to
I
fill theirs.
just know that deadline-driven work
I agree with you
is
completely.
often the most efficient and determined work, and I want
I agree.
something that's fair to hold you accountable to. So will you get a
Well,
target date?
We'll work together to see where
Mr.
it's at right
Secretary,
now.
isn't it?
I'm not going to play the game. Okay.
What game?
Because it's not a game because there's no other facility in the world that will say by X date, we're going to definitely have people hired.
I didn't say you definitely. I'm looking for a goal. You don't think leadership at other healthcare facilities set
I think
goals
you-
for when
I
they're going
mean-
to fill open medical slots?
I think they fill them as quickly as they possibly can. We hire over 1,000 people.
Okay, so
a
you will
month.
not present a target.
I would like to
date
have it. I would like to have them filled by the end of the fiscal year. That'd be great.
by the end.
Now,
of the fiscal
will
year.
it be filled? I'm not going to say they'll be filled because there's a lot of other factors in there that
Yeah.
I can't control.
Mr. Secretary, and I know we're belaboring this, Mr. Chairman, but this isn't a gotcha. What I'm saying, this is just
Well,
good management practice. I just want
I
to
get
know. I want to know
I get
when you believe it can be done. Well, I tell you what. Let's put it that way.
Hopeful.
No, you don't need to tell me right now. I'm
Yeah.
not even trying to put. Why don't you talk to the VISN, talk to the facility, talk to your staff, and come back and let me know by when you think it can be done. Will you do that?
I look forward to the conversation.
It-
Yeah, I mean, I look forward to the conversation.
Will
I
you
mean,
let me
you're
know-
asking for me an answer that I can't give you because I've not talked to the other people.
I'm
you
not
just asked
asking
me to
for the
talk to.
date. I'm asking if you can give me a target.
Yes, I can get. We can look toward giving you a target. Yes.
Okay. That's all I needed on Atlanta, Mr. Secretary. Thank you.
Thank you.
I just got some additional questions about a letter that I sent you at the beginning of this Congress. But first, Augusta. WRDW, WJBF, Augusta reported this month, an IG report says VA Augusta leaders fostered, quote, a culture of fear with a, quote, threatening and abusive communication style and allegedly retaliated against employees who shared concerns. I know the acting director was put on leave pending an investigation. I think that's a positive step. We spoke yesterday, Mr. Secretary, you confirmed you were recruiting for leadership at both of these facilities. Can you confirm that it's among your highest priorities to get a permanent new leadership staff in at Augusta?
Yes, and I'm to further elaborate without trying to belabor this because I know where we're at, but there's actually two incidences here that I'm going to report. The one that you just mentioned was done earlier, if not right before I came in, and that was the workplace issue, the leadership issue. That person actually was I called, failed up, and was put in the visit and administrative role. I made the call that we needed to put that person on administrative leave because if the reports had already shown that there was a toxic workplace, putting our veteran employees and our VA employees in a bad place in a workplace. So that one was out. That was the issue we did then. So then there's another that we tried to replace that one with that unfortunately I can't speak in open setting for personnel issues and reasons here, but has been removed as well. And that's when, as I told you yesterday on the phone, we now have another acting, I think is in now, correct? There's another acting is in at Augusta, and we are looking to finish your question. I just wanted to give you the total picture. We are looking for permanent. That should be one of our flagship hospitals in our system. And so, yes, we're looking for someone to take that permanently.
Okay, final issue, and thank you, Mr. Chairman, for indulging the questions. Sent you a letter February 13th, a number of members of the Appropriations Committee asking some basic questions about DOJ engagement with the VA at 13 specific oversight questions. You and I then spoke on May 6th. So we hadn't gotten any kind of meaningful response. You committed to get me meaningful responses. Still have not gotten responses to these questions. And I think this is an opportunity to bring transparency to an issue about which there's been a lot of public controversy and concern. So I haven't gotten answers to these questions that I asked and a number of members asked in February. So I want to ask you now, which DOJ personnel have visited VA facilities?
I don't understand the question.
Okay, which DOJ personnel?
Okay.
So personnel who are acting under the auspices or authority of the Department
We
of
have
Government Efficiency have visited, let's start with VA headquarters.
You talking about our liaisons who actually work for the VA?
I'm asking,
We have three.
I'm asking which DOJ personnel have visited VA headquarters?
The ones that work for us.
Okay, what are their positions?
They're advisors. They're looking at through our contracts and stuff like that.
Okay, are they still doing that?
Yes.
Okay. Have they accessed VA patient medical records?
They are acting in their role as employees as a normal VA employee would do, and are authorized to do anything that they're currently doing.
So,
And I'll be happy to take these further for the record if you like.
well, Mr. Secretary, I asked you these questions on February 13th in a letter.
Okay.
It's the end of June. I mean, you were a member of Congress. Would that be satisfactory to you?
If I'm offering you a solution, yes.
Well, we spoke in
And
May.
I'm offering you a
said-
solution.
No, come on, Mr. Secretary. I asked you these questions in February. We spoke in May. You said you get me the answers, and here you're saying you'll take
And
them
in
for
all
the record.
fairness, you just asked me a question about who DOJ employees walked into my facility.
A question
Don't
I
tell me you're
first
trying
asked-
to be
a question I first
serious
asked you
about
in
this. I mean, what DOJ employees? I mean,
No, what I just
yeah.
asked you was,
Mr. Chairman.
what I just asked you is, have DOJ personnel access
I'll be
the
happy to take-
medical records of veterans?
and
in
I
the
have
VA
told you
database?
that I told you they're acting in the roles under everything. that
There
they're
would be a
supposed to as
lot
VA.
less concern about this if the answers weren't so cagey on it all.
There's no caginess to it. Any VA employee who has access to anything and work at the VA is totally responsible and trained.
Let's
to do
work
what they do.
together, Mr. Chairman, to get some clarity on this, because I'm not satisfied. It's been months. I don't know why there is such a lack of willingness to engage on this topic. We will follow up, Mr. Secretary.
Thank you, Mr. Speaker. Senator.